The whole topic of postpartum depression came into sharp focus in this country, sadly, in September, when there was a case where this young lady, Ms. Raghubar, sadly took her own life. And, there was lots of sadness, lots of outcry about what happened with this woman. And why would she do such a thing? Because she's young, she comes from a well-to-do family. Why on earth would she feel to throw herself off a balcony in Tobago? And she went there for relaxation. But we will get an idea of why in a bit. The next news item that I recall, I saw from this weekend that an 18-year-old was found to have had a dead child in her room for about 8 months. And, without knowing exactly what happened with this young lady and why she would do such a thing, it's very bizarre behavior, and more bizarre that the whole family colluded with this behavior. I cannot help but wonder, she is within the period for postpartum depression and postpartum psychosis. And I wondered if this is a reflection of that. So, as I said, why such extreme behavior in these women? Now, postpartum depression is also called postnatal depression. It apparently depends on which side of the Atlantic you are on. This is a clinical type of depression which affects 10 to 15% of women after giving birth. The symptoms are similar to those of depression in other times and include low mood and other symptoms lasting 2 weeks, at least 2 weeks. Depending on the severity, women can struggle to look after themselves. They also struggle to look after their children. This can also come when there isn't a baby at the end of the pregnancy, in case of birth trauma, as well as miscarriages and stillbirths. And it's interesting to note that new fathers also can get postpartum depression. And in a US study, it was quoted between 1 to 25.5% of men develop postpartum depression. Now, the onset is usually between 2 to 4 weeks after delivery. The recent studies show that 50% of postpartum depression began prior to childbirth. That's why in my talk, I am going to be talking about more like a perinatal depression, because it's more that flavor. Because for most part, 50% of the part, it begins before the mom actually gives birth to the baby. The DSM-5 diagnosed postpartum depression is a depression occurring within the peripartum onset, okay? And it's interesting to note that postpartum depression is not the same as baby blues. Postpartum depression, the symptoms are usually the same for ordinary depression. My slide just suddenly disappeared. Okay, I'll continue in the meantime. The symptoms usually include low mood, tiredness, exhaustion, low energy, low self-confidence, low self-esteem. They would have poor sleep with early morning waking. Even if the baby is sleeping, they would not be able to sleep. There'd also be poor appetite, a loss of enjoyment called anhedonia in their life, social withdrawal, isolation, and feelings of emptiness. They would often be irritable with feelings of frustration. Right. There we are. With feelings of frustration and they have an inability to be comforted by those around them. There's also a decrease in the sex drive, and they have occasional frequent anxiety. There's also negative and guilty thoughts that they're not a good mother because they're not looking after themselves or the baby, so they feel very, very guilty about that. And they feel that the baby doesn't love them. And they have feelings of being overwhelmed. They also develop suicidal thoughts in more serious cases, and psychotic symptoms, hearing voices, and having unusual beliefs. Now, I'll deal with a milder form of, it's not postpartum depression, but it's a mild form of depression that occurs after childbirth. This is called postpartum blues or baby blues. This is commonly a transient postpartum mood disorder. It's characterized by mild depressive symptoms, and you have the same thing: low moods, mood swings, tearfulness, anxiety, irritability, etc., from what we mentioned there before. This type of depression can occur in 80% of all mothers following delivery, and the symptoms typically resolve within the first 2 weeks. So within the first 2 weeks, they would feel terrible, but after that, they settle down into their role of motherhood and can move on. The symptoms lasting longer than 2 weeks usually indicate that the woman has developed a postpartum depression. The causes of postpartum depression, there have been many suggestions. It's not clear. It's not clear exactly what causes it. There's a hypothesis of hormonal changes, that genetic and major life events and pre-existing mental illness have all been identified as possible causes. The evidence suggests that hormonal changes may play a role, and hormones such as estrogen, progesterone, thyroid hormone, which has been shown to have significant role in depression, generally, all seem to be candidates for this. Fathers who are undergoing profound hormonal changes can also have postpartum depression. And it seems that the cause, of course, in men is different. There's usually a family history of postpartum depression, and major life changes such as death in the family, loss of close relationships, breakdown in relationship with the partner, a poorly supportive family, and the profound change of having a child, and especially if that child was unplanned for and not welcome. The mother also has, some mothers also have several previous childbirths and not had any problems with postnatal depression. So it means that it doesn't guarantee that you're going to get it every time that you have a baby. And that's also interesting to note. It's also important to remember that pre-existing mental health problems play a major part here. Depression and anxiety before and during pregnancy usually sets the individual up for having postpartum depression. And sometimes there's no cause. There's no reason why this individual will become depressed, but it just is. Now, there are a whole list of risk factors that I'm not going to go through because it's in the interest of time, but it's interesting to know that there are many risk factors associated with postpartum depression. One thing to note, though, in a study with Caribbean women in Manchester, UK, the Caribbean were found to have lower scores for prenatal depression. However, once they had the baby, they had higher scores than the white population for postpartum depression, and they were also less likely to seek help. There's also a risk factor to keep in mind, too, with regards to violence towards women. Women who are being brutalized in their homes are more likely to present with postpartum depression. Now, I think I'm likely to run through this quickly. Depression and anxiety are common mental health problems during pregnancy, as I've mentioned. Around 12% of women experiencing depression and 13% experiencing anxiety. Depression and anxiety also affect 15 to 20% of women in the first year of childbirth. So it doesn't just go away. Anxiety disorders, including panic disorders, generalized anxiety disorders, obsessive compulsive behavior, PTSD, and tocophobia, which is a fear of having children, can occur on their own or can coexist with depression. Psychosis can re-emerge, as we know, and postpartum psychosis affects 1 to 2 in 1,000 women who have given birth. Women with bipolar affective disorder 1 are particularly at risk of developing postpartum psychosis, which I'll talk about soon, which is a more severe of this illness. I'm now going to go through that. This is talking more about people with eating disorders and people with illicit drug and alcohol abuse. And smoking is also likely to develop postpartum depression. I'll skip through that. Where are we? All right, diagnosis, we all know through DSM-5. I'm not going to linger there. And ICD-10 does not really recognize postnatal depression, as they would call it, but it's considered to be part of a normal depression that develops 6 weeks after delivery. It's interesting to know that the Edinburgh Postnatal Depression Scale, which is a 10-item questionnaire, has been developed to identify women with postpartum depression, and the items correspond to various clinical depression symptoms that have gone through already. The overall assessment shows that the higher the score, the more likely are that they are depressed. In a study done in the Caribbean, it was interesting to note that in Jamaica there was not a correlation for the Edinburgh Depression Scale, and that the brief scale for depression was more useful in the setting in Jamaica, according to the researchers. Well, the importance of treatment is probably self-evident. For the most part, this depression goes away in 3 to 6 months for itself. However, 1 in 4 women would still be depressed when their child is 1 year old. The untreated depression can cause many difficulties with regards to their bonding with their baby, with their partners and their family, and there's usually lots of disruption within the family. Now, I'll just go through treatment. Treatment options are basically talking therapy and medication, alternative medicine, and electroconvulsive therapy. What we know about talking therapy, just low-grade counseling can help some women. They may need more skilled therapists in cognitive behavioral therapy, and there are other therapies that are available that look into the person's relationships, etc., sort of like a psychodynamic approach. The treatment of the medication, there are lots of guidelines in the UK with regards to what women get, and by the National Institute of Clinical Excellence, which I'm not going to bore you with right now, and the bell has gone. So, speeding quickly through, one thing I wanted to say is that the summary, right. In summary, you can see the medication that's recommended. Antidepressants, usually the older generation, and sertraline is particularly useful. Antipsychotics, the older generations again, and some of the newer generations, olanzapine. Risperidone, quetiapine, aripiprazole are also growing in information. And of course, you can give sedatives, but mommy has to remember not to sleep with the baby in the bed. It's important to note breastfeeding is a factor that you have to consider in postpartum depression. because, women want to breastfeed, but unfortunately they also need to have medication, and the medication will go into the breast milk. If these women needed to have treatment during the pregnancy, it's likely the baby would also be getting a dose of that medication. Sometimes it's even helpful for the for the mother to continue with the medication and continue to breastfeed so that the baby would have less of a withdrawal syndrome. And it's important also to look at the baby to be sure if the baby is getting toxic on any of the medication that the mother might have to be taking. And ECT, we know, we don't do ECT here really, but it's very useful in depression. Alternative remedies, St. John's wort. People like to buy this in the pharmacy and it says, oh, it's herbal. Sorry. Where are we? Yeah. They say it's beneficial, etc. But there's interactions with other medication. And what can happen, you finish? Completely. Okay, quickly, I'm finishing now, seriously. What can happen? Sorry. So what can happen is you can have interactions with birth control medication and they could become pregnant again. It's important, let me wrap up by saying, the services for these women are very important. Postnatal depression is underreported by the women and under-identified by professionals, usually in the Caribbean. And to have a specialist service would also be very important for them to foster their bonding, etc. So thank you very much.